that Dr. Sheila Babu. Dr. Sheila, she is going to present the poster on macular structure-function relationship in advanced glaucomas involving the central 10 degree of the field.
Good morning, all. I'm happy to present the study we conducted in our hospital. It's a macular structure-function relationship in an advanced open-angle glaucoma involving the center 10 degree of fields. Here. In glaucoma, monitoring of visual fields to detect any progression is the mainstay of glaucoma management. However, this often poses a challenge in elderly patients with advanced glaucoma who are often unable to perform reliable fields as perimetry requires patient cooperation both in terms of physical and mental conditions. So here we need to study the appropriate structural parameters which correlate well with the visual field effect. And in glaucoma, the inner retinal layers, that is the retinal nerve fiber layers, ganglion cell layer and inner plexiform layer are the one gets primarily affected. And circumpapillary RNFL measurements may not be ideal in advanced glaucoma because when the RNFL thickness reaches a measurement floor but not zero because to non-neuronal elements such as blood vessels, retinal glial cells which do not degenerate concurrently. So hence we conducted this study, look for other macular structural parameters and their correlations with the central field effect in patients with advanced open-angle glaucoma. And this was a prospective observational study conducted at the Department of Ophthalmology of a tertiary eye care center between June 2020 to October 2021. And patient attending the glaucoma clinic who was diagnosed as open-angle glaucoma with no macular pathology with advanced field effects involving the central 10 degree of visual field was analyzed by HFA 10-2 program were recruited after getting the concern. And here the visual field effect, that is the pattern and standard deviation in each of the 4 quadrants of HFA central 10-2 field was documented. Similarly, the macular structure average thickness of GCL plus IPL and GCC was documented in the corresponding quadrant in the central posterior pole program of the macula using Heddle spectralis OCT machine. And this is the posterior pole analysis program which divides the central 20 degree of the macular region into 64 equally distributed arrays by 8x8 field grid. And within these cells, the thickness was calculated and the numbers was given. Initially, we analyzed that each quadrant by adding the 16 cells in each quadrant and taking the average. Similarly, in HFA also, the quadrant which contains 17 points was analytical, like we added together and took the average. And we calculated our sample size for the sample correlation coefficient of 0.75 and it was done under Peterson correlation coefficient and scatter plots were used and p-value less than 0.05 was considered as statistical significance and all the analysis was carried out using SPSS The result is significant structure function correlation was found between all macula inner layers studied GCL plus IPL, RNFL and GCC in the supranasal quadrant and the corresponding field effect in the infratemporal quadrant. Rest of the quadrant showed thinning of the inner macular layer, more thinning of the inner macular layer as compared to the supranasal layer. And this is the scatter plots we made, and that it shows the p-value get is less than 0.05 and considered statistically significant. So as we know, the nasal fibers are probably the last to be lost in glaucoma, and supranasal quadrant has shown good correlation with the corresponding visual field in our patients with advanced field effect, and similar correlation was not probably found in infranasal and other quadrants of the macular region, because there was a more thinning than supranasal region seen in other macular layers. So this is probably because of the very advanced disease caused a severe loss of neuronal elements in these quadrants, and no correlation can be statistically seen. So we hence it likely that only supranasal quadrant inner macular layer are preserved in very advanced disease, and patient with less advanced field effects may show good structure function correlation in all other quadrant. On conclusion, for study, we found moderate significant negative correlation between all the macula inner layers in the supranasal quadrant, and the field effect in PSD in HFA 10-2 in the infranasal quadrant we can see. So hence monitoring these structural parameters in the supranasal quadrant may be useful in detecting progression in patients with advanced glaucoma who are unable to perform reliable fields. Thank you.
What did you choose for
Ma'am,
your
it's an open-angle glaucoma.
It's all primary open
Primary
or secondaries
open-angle
also?
glaucoma, normotensive glaucoma, and pseudo-exfoliative.
So did you choose any of the myopic eyes in that?
No, ma'am. No, it's...
What was your correlation coefficient, the R value?
Pardon, sir?
So you've said that there was a moderately significant negative correlation of moderate strength. So did you do the correlation coefficient? What was the R value? Or it was not a linear association, I suppose. It's not usually. I mean, how did you analyze that, basically?
Correlation coefficient is 0.75.
Minus 0.7.
Minus 0.75.
Yeah, because usually in these advanced glaucomas, it's not you can't use a linear. It's not a linear correlation. It tends to change.
It's a negative correlation we usually get when the macular thinning layer is reduced. That in HFA we get negative correlation. It will be more.
Right.
Minus.
So
minus.
So there are other statistical tests actually that can be used for these when you're not expecting a linear correlation exactly.
Yes.
What he means to say is that in advanced glaucoma, because of the fluctuation, we cannot use the linear model for any analysis. So there are various other methods where you can use that for the analysis.
Okay.
That is what. Okay, but nice.
Ma'am, sir, we have took the patient who is not having any macular pathology. Like maybe they have diabetic hypertensive, but in this study we took the cases which doesn't have any macular pathology. Pardon, I couldn't get you.
Pseudo-exfoliation syndrome. Did you have any of your patients?
Yeah, 3 patients we had. 3 patients.
Subluxation.